to diet, it's best to consult a dietitian, or a registered dietitian or a physician, and obtain a customized diabetic diet plan for you. There is no set amount of carbohydrate for the diabetic diet plan, but a moderate amount of protein and low amount of fat is generally recommended. Fat quality is more important than quantity, so we recommend the monounsaturated and polyunsaturated or the good fats versus the bad fats like trans fats, and to have a high intake of fiber and natural foods like fruits and vegetables, and to have good habits as in to eat at the same time every day, to eat small frequent meals throughout the day, especially if you are using insulin. It helps, and exercising, it helps to keep your blood sugar control throughout the day. Benefits of exercise in general, it helps lower HbA1c and blood glucose levels in general, and also decreases your cardiovascular disease risk, hypertension risk, and osteoporosis risk, and obesity. All those things are all those comorbidities are risks are lowered, and it also improves your general muscular fitness, cardiovascular endurance, flexibility, strength, and makes your self-esteem increase and your self-worth go up as well. But the most important thing about exercise is the fact that it increases your body's sensitivity to insulin, especially in the cases of type 2 diabetes. So when discussing risks, the most common one to watch out for is episodes of hypoglycemia or low blood sugar, and cardiovascular accidents like heart attack or angina. And certain exercises can worsen diabetic retinopathy and nephropathy and other complications as well. So it's always best to train or get guidance by a qualified person who is certified in training special populations. In general, we ask people with diabetes to check with their physician before engaging in a physical activity program and get clearance, and also to monitor their blood glucose level periodically. If you have a blood glucose level of 100 to 250, you can safely engage in exercise. If it's less than 100, you must consume a carbohydrate-rich snack and increase the blood glucose level to over 100 before engaging in exercise. Or if it's more than 300, exercise should be postponed until you normalize your blood glucose level. So those are the contraindications for exercise. And to maintain good hygiene, use proper footwear, and to eat meals at the same time of the day, to take your medication, and exercise routine. Keep everything uniform, so it's very easy to monitor the glucose and keep it as normal as possible throughout the day. Hypoglycemia is not totally preventable, but we can take necessary steps to avoid it. And if you have signs and symptoms like if you're shaking, sweating, difficulty speaking, and confusion, it's always good to check the blood sugar. And if it's less than 100, the recommendation is to take about 20 to 30 grams of carbohydrate-rich snack like orange juice or candy, and then measure the blood glucose 5 minutes later up until it reaches more than 100. And until then, the exercise should be postponed. If you are taking insulin, it is recommended to take insulin 1 hour prior to exercise and into a preferably into a non-exercising muscle group. And to speak to your physician about, sometimes you may require to reduce the dose of insulin when taking part and continuing an exercise program. So the exercise recommendations for type 1 diabetes is that you engage in physical activity for about 150 minutes of moderate intensity activity or 60 minutes of vigorous intensity activity 3 to 7 times a week in about 20 to 30 minute sessions using large rhythmic movements of your major muscle groups. So you can do walking, jogging, cycling, swimming, rowing, all of that. So for type 1 diabetics, we recommend resistance training of the major muscle groups about 3 times a week, 8 to 12 repetitions per exercise, and 1 to 3 sets per exercise. So for type 2 diabetics, the exercise recommendations for the cardiorespiratory program is that you exercise 3 to 7 days per week, about 30 to 60 minutes in duration, with no more than 2 days missing consecutively, and about 150 minutes per week in duration. If you do more than 300 minutes per week, because most of them are obese, it will have more benefits. And again, using large muscle groups, walking, rowing, cycling, swimming. When it comes to resistance training, focusing on major muscle groups 3 days a week, about 8 to 12 reps per exercise, and 1 to 3 exercise per 1 to 3 sets per exercise, and about 4 to 5 exercises for the upper body and 4 to 5 exercises for the lower body. So thank you, and if you have any questions, please don't hesitate to comment below or reach out to us, and we hope to discuss metabolic syndrome in our next series.